Inflammation can stay hidden long before symptoms appear. CRP, or C-reactive protein, is a substance made by the liver when the body is responding to inflammation. It does not point to one specific disease, but it does tell us that the immune system has been activated somewhere in the body. That makes CRP one of the most useful general biomarkers for tracking inflammation. Doctors often measure CRP with a simple blood test. Standard CRP is used to detect stronger inflammatory responses, while high-sensitivity CRP, often called hs-CRP, can detect lower levels linked to long-term cardiovascular risk. In general, lower levels suggest less inflammation, while persistent elevations may signal a deeper issue worth investigating. This matters because chronic low-grade inflammation is strongly linked to many age-related diseases. Higher CRP levels have been associated with cardiovascular disease, metabolic problems, and other conditions tied to declining health span. In longevity science, this ongoing inflammatory burden is often described as inflammaging. CRP becomes especially useful when it is viewed in context. A temporary rise might come from an infection, injury, or recent illness. But if CRP stays elevated over time, it may reflect chronic inflammation driven by factors like obesity, smoking, poor sleep, stress, or metabolic dysfunction. That is why CRP is not a diagnosis on its own. It is a signal. It helps show whether inflammation may be playing a larger role in your health, especially when combined with other biomarkers and clinical information. Explore the full article in the description below. Subscribe for more evidence-based longevity videos, and find recommended longevity supplements in the description. The key takeaway is simple. CRP is one of the clearest blood markers for inflammation, and tracking it can offer useful insight into long-term health and disease risk. For more longevity insights, visit longevityinsights.co.uk today.